It's becoming more apparent every day that the cost of Obamacare is exceeding even the worst estimates. A post at John Goodman's health policy blog documents the sharp rise in premiums. Now, the Congressional Budget Office, the congressional agency that originally calculated Obamacare would actually reduce the deficit, well, the CBO now estimates the new law will cost taxpayers nearly $2 trillion. Dr. Goodman recently told a congressional subcommittee there's a simple reason why.
So, Mr. Chairman, I think that our problems arise because we've suppressed the marketplace, and if we want to solve these problems, we have to allow the market to exist and get the incentives right. Now, can the market work in healthcare? My answer is that you show me any part of the healthcare system where the third-party payers aren't. Show me a part of healthcare where there's no Blue Cross, no Medicare, and no employer, and I'll show you a market that's probably working pretty well.
He explained that a significant contributor to the rising cost of healthcare is the rising cost of Obamacare.
Obamacare greatly expands the demand for care. It doesn't do anything about supply. So anybody who's in a plan that pays below market is going to have an access problem. Most of what's going to happen was not actually written in the legislation. It is up to the discretion of the Obama administration.
So how does all this affect our economy? Those stock market numbers have been a little bit volatile of late, right? Well, NCPA distinguished fellow Bob McTeer told CNBC maybe there is an economic recovery afoot, but then again, maybe not.
The positive mood out there, I think, is based more on what's been happening to the stock market than what's been happening to the economy.
One area to watch, says McTeer, is housing.
If I had in mind buying a home anytime soon, the uptick in rates would get me off the dime. I wouldn't be a bit surprised to see it encourage buying in the short run.
Then there's the question of quantitative easing by the Fed in Washington and interest rates facing Americans on Main Street. McTeer says current Fed policy isn't really leading to easier money.
I think it's beginning to dawn on people that as hard as he's been pushing to get the money supply growing faster, it hasn't. It's growing less than 7% a year, and the velocity of money is going down about 3.5% to 4% a year. Money is not that easy in terms of what's getting to Main Street. What we've had so far with the QE is just balance sheet changes on the Fed's balance sheet and on commercial banks' balance sheets.
The Fed watch never stops when it comes to what all this means for interest rates, but Dr. McTeer told CNBC's Larry Kudlow if the numbers are going to continue to improve, Fed Chairman Ben Bernanke will need to start tightening interest rates judiciously.
I want to know your opinion. You're a straight shooter. Should Ben Bernanke tighten up? Should he taper down his bond purchases?
Not real soon. He should do so maybe toward the end of the year, taper down just a little bit. He needs to clarify that he's not going to do it real soon. This is crazy what's going on in the market.
The NCPA has also launched an education blog. The lead researcher posting at the blog is NCPA senior fellow John Merrifield. The blog focuses on choice and control in secondary education. The first publication featured at the blog, a study showing that if the state of Texas provided public school students a voucher worth just 75% of average per pupil spending, the state's taxpayers would save nearly $2 billion. So how important is NCPA research? Listen to Fox News Channel host and former presidential candidate Mike Huckabee.
Dr. John Goodman is president and CEO of the National Center for Policy Analysis. I've often said I think it's maybe one of the smartest think tanks, if not the smartest one in the country. Let me direct people to your website, ncpa.org. And if you're not on their daily email list, I am, because I find that their articles and insights are the best I get each day.
And Rush Limbaugh.
Why the White House is panicking about Obamacare. But they're doing this, Goodman says, because they're desperate. They're looking for help. Help with getting people to enroll in health insurance plans. Why is that? Because the regime is facing the very real possibility that its signature piece of legislation may fall flat on its face.
This is work we could not do without your continued support. So for more information about these important issues and the NCPA, please contact us. You can call us or send us an email. We want to know what you think. And thanks for your support of the NCPA and the important work we're doing.